Good day. We are the Myanmar group and we are going to present the group work 2. Myanmar recorded only 360 COVID-19 cases and 6 deaths from late March to early August during the pandemic's first stage. But things quickly got worse in early August. There were only about 10 cases per day. By mid-October, there were over 1,000 cases daily. This demonstrates how rapidly the virus spread following a time of low numbers. What were the challenges Myanmar faced during the pandemic? During the pandemic, numerous Myanmar residents struggled to acquire medical care since healthcare was difficult to obtain. The entire country also had financial difficulties, which resulted in the closure of numerous businesses, which increased unemployment and poverty. Furthermore, it was even more difficult to effectively handle the crisis due to the unpredictable political environment. What were the policies Myanmar implemented to address this during the pandemic? During the pandemic, Myanmar tried to contain the virus by closing places and restricting travel. To identify sick persons more quickly, they established quarantine centers and increased testing. To keep everyone safe, the government also promoted vaccinations.
So now let's talk about how Myanmar helped out during the COVID-19 pandemic, especially in working with other ASEAN countries. Even though Myanmar was going through a tough civil war, it still played an important role in supporting regional efforts. So first off, Myanmar took a part in ASEAN meetings focused on the pandemic. These meetings were all about figuring out how to handle the crisis and sharing what each country was doing. Despite the challenges at home, Myanmar shared its own experiences and challenges, helping everyone understand different perspectives and find better solutions together. Myanmar also supported the ASEAN Comprehensive Recovery Framework. This plan was designed to help all ASEAN countries recover from the pandemic, addressing health, economic, and social issues. By backing this plan, Myanmar showed its commitment to working with its neighbors to overcome the crisis, even while dealing with its own internal struggles. And yeah, lastly, Myanmar was great at sharing useful information. It talked about what worked well in its own pandemic response and what didn't. These help other ASEAN countries learn from Myanmar's experiences and improve their own strategies. Sharing these lessons made a big difference in how the region tackled the pandemic.
So, continuing from the post pandemic statistics of Myanmar from 2023 to 2024 on tourism, economy, and healthcare at its present date, Myanmar's economy faces significant challenges that is constrained by the elevated conflict that increases the macroeconomic volatility and a difficult business environment that urges livelihood in Myanmar to be under threat by the economic monitor. And then, if the pandemic did improve Myanmar's policy on healthcare, while more than 70% of healthcare workers in Myanmar has decided to leave the country itself due to the ongoing attacks for healthcare facilities that's being constrained by the workers by the government themselves despite of the pandemic, and violence has been a widespread occurrence throughout the country with large ethnic minority populations that has been attacked by the government themselves. And in conclusion, Myanmar's experience during the first wave of the coronavirus pandemic highlighted critical challenges and responses throughout the country. And despite these measures, the complexities of economic hardships and political instability presented several obstacles in managing a pandemic in a resource constrained environment. And that is all. Thank you guys for listening, and I hope you have a lovely day.